Welcome to Stroke Smart, your trusted channel for brain health and stroke prevention. Today, we're exploring a critical topic: the difference between an ischemic stroke and a hemorrhagic stroke. These two types of strokes have very different causes, symptoms, treatments, and outcomes. And knowing how to tell them apart could save a life. A stroke happens when blood flow to the brain is suddenly interrupted. Since the brain relies heavily on oxygen, just a few minutes without it can lead to permanent damage. There are two main types of stroke: ischemic stroke and hemorrhagic stroke. Ischemic stroke is the most common, accounting for around 85% of all strokes. It's usually caused by a blood clot or a buildup of plaque that blocks an artery leading to the brain. When this blockage occurs, oxygen and nutrients can't reach brain cells, causing them to die. Common risk factors for ischemic stroke include high blood pressure, high cholesterol, diabetes, smoking, and a sedentary lifestyle. The symptoms often include numbness or weakness on one side of the body, facial drooping, slurred speech, balance problems, and sometimes blurred vision. In many cases, there's no pain, which makes it harder to detect. If caught early, within 4.5 hours of symptom onset, ischemic stroke can often be treated with clot-busting medication. This is why early recognition and fast medical attention are so important. Hemorrhagic stroke, on the other hand, is much less common but significantly more dangerous. It occurs when a blood vessel in the brain ruptures, causing bleeding directly into brain tissue or the surrounding areas. This type of stroke is often caused by long-term high blood pressure, aneurysms, arteriovenous malformations, trauma, or excessive use of blood thinners. The symptoms are typically more dramatic: a sudden and severe headache, nausea, vomiting, confusion, seizures, loss of consciousness, or even coma. Unlike ischemic strokes, hemorrhagic strokes usually come on fast and hit hard. Treatment for hemorrhagic stroke focuses on stopping the bleeding, controlling blood pressure, and reducing pressure inside the skull. In some cases, surgery is required to remove accumulated blood or to repair the damaged blood vessels. Now let's compare the two. Ischemic strokes make up about 85% of all strokes and are caused by blockages. Hemorrhagic strokes make up about 15% and are caused by bleeding. Ischemic strokes may come on more gradually and seem milder at first, while hemorrhagic strokes are typically sudden and severe. Treatment for ischemic stroke involves restoring blood flow, often with medication. Hemorrhagic stroke treatment focuses on controlling bleeding and pressure, and may involve surgery. Mortality risk is generally higher with hemorrhagic strokes because early symptoms can overlap. Doctors use brain imaging, such as CT or MRI scans, to confirm the diagnosis and guide treatment. In both cases, time is brain. The faster a person receives medical care,